patient experience is really important to me. I value what happens to people in the hospital, and we know if we get the patient experience right, that a lot of good things flow from that. Patient safety, quality care, and probably the staff experience as well.
My role is to transport a patient from the room to a procedure, and I try to interact with them all the way through the hospital in a positive way, talking about anything that goes on throughout the daily lives of everybody around us. And my intention is to raise the spirits of that patient that I'm dealing with at the time.
My experience at King Eddie's was second to none. The midwifery group practice was amazing support for me to achieve my vaginal birth after 2 caesarean sections.
In making our programs, we make sure that we consult people with what information that they would like to learn, and doing that in a culturally appropriate way. So we know that in supporting Aboriginal people around their health and wellbeing, that we need to be inclusive of them as an individual, as a family and as a community, and we need to do this in a holistic way that empowers and supports them to take control of their health and wellbeing.
Patient experience is working with the patient's unique circumstances. Everybody's unique. It's working with their carers, their significant others, their support systems, their strengths. In essence, for me, the health system helps build the house perhaps, but it's the patient and the carers who help design, and they are the ones who choose the colors.
What made this great for me as a brilliant patient experience was the caring, compassionate staff, treating me as a human, not just as a number, and working under huge pressure. They still gave me a huge amount of attention.
We are contributing to improve patient experience by developing some tools that are going to allow patients from culturally and linguistically diverse backgrounds to be able to provide their feedback in relation to the patient experience.
The patients come in from all different angles. They come through emergency, they come through elective procedures. They don't want to be sick, but when they do come to us, the ability for us to provide a journey through their clinical care, through the relationships that they have with the clinical team, makes a big difference to the outcome.
I think probably the most important value to me as a doctor is that the patients I personally see come away feeling like somebody cares about them.